right, good evening, Facebook friends. I'm happy to be here tonight to answer some questions that have been submitted in advance and whatever questions come in during the hour that we're here. Hoping that I can get you some good information that can help you understand what the current situation is regarding coronavirus in Monterey County and on Monterey Peninsula specifically, and also get you some good information for what you can do to protect yourself and those who are near and dear to you from spreading coronavirus or getting infected. I think we wanted to start maybe with just a general overview.
Yes, our first question for you, Dr. Blum, is tell us about the state of COVID-19 on the peninsula and the county, what's happening at Community Hospital, and is Community Hospital ready for a potential surge in patients?
Okay, well, there's a lot packed into that, and I'll start with just sort of what's happening at Community Hospital and on the peninsula. So many of you are probably hearing every day information on the local news, in the newspaper, or even just from your own searches on the web or talking to friends and family. But it's really, we've experienced at least 3 distinct phases of this pandemic. I know a lot of people talk whether or not we're in a second wave, but really if we look at it, it's all one wave of this pandemic as it's gone across Monterey County, but it has had some sort of distinct phases. From the very beginning, our first case was diagnosed in Monterey County on or around the 17th of March. And so from that first month, from mid-March to mid-April, that's where we saw a lot of cases that may have been for people who had traveled to Europe. So definitely returning travelers were part of that. And I don't know, that was when we were all asking those questions about, have you been to these highly affected areas? Had you been to China? Had you been to Europe? So that'll take you back to what it was like from mid-March to mid-April. Then in Monterey County, by mid-April, things had changed a bit. And that's where we started to see incoming agricultural workers who come here seasonally. And so things started to change a little bit starting mid-April. So we saw this kind of distinct separation on different parts of the county where we saw that really uptick. And that was the phase we were in from mid-April to about mid-June. Now, beginning mid-June, just about 2 weeks ago, we've seen another sort of distinctive phase where we've now seen a big increase in community spread, where we're seeing lots of cases in close contacts. So again, this is not necessarily a different wave, it's all the same thing, but now we're seeing that particularly on the peninsula, we've had a noticeable change. So what we're seeing is we are diagnosing new cases every single day, and that had not been the case at Community Hospital for a couple of months. The other thing that we're seeing is that we've had almost half of our cases, total cases that were diagnosed at Community Hospital, were diagnosed in the last 2 weeks. So it's been, again, a noticeable change. And I know a lot of people were wondering, is this because of increased testing? Is it just because more people are tested, more of them are positive? Well, that is part of it, but we are seeing an increase in the percentage of tests that are positive. So that indicates that a larger proportion of the people that are being tested are positive. And to go hand in hand with that, we're seeing more people being admitted to all of the area hospitals, including Community Hospital. So that's the current sort of state of the pandemic and how we got there. And it has been, as I say, really evolving in the last 2 weeks. Now, the other part of Monica's question here was, is Community Hospital ready for this potential surge of patients? Yes, we are. I mean, we've prepared for this beginning from very early March, and we've had a series of plans for how we would continue to expand and accommodate increasing numbers of people with COVID-19, including people who may have moderate to severe disease, who may need really advanced medical care in an ICU. All those plans were still in place, and they can be expanded or contracted as needed, depending on how many people are really in need of acute hospital care. So we remain ready for whatever comes our way, but hopefully by the end of the hour, we'll have some information so that people will have a better understanding of how they can avoid needing to be hospitalized for treatment for coronavirus by protecting themselves.
those of you that were having trouble hearing, we've moved the mic closer to Dr. Blum, so hopefully that helps. Okay, so we have our first question from Barbara. Where can one find information on the number of COVID-19 cases specifically on the Monterey Peninsula as opposed to the whole county? And how much of the recent increase in cases is due to more testing versus more people becoming ill with the virus?
Great question. So, like Barbara, I am very interested in the numbers, and particularly the numbers as they pertain to Monterey Peninsula, which is the main catchment area for community hospital. And I would refer everyone to the Monterey County Health Department webpage. They have a whole section on local data, which is incredibly detailed and updated daily. So it's a great resource. But even there, I can see that people, when they're wanting to know what's going on in their own particular zip code, particularly if it's on the peninsula, they may be wanting a little bit more information. So just to give it overview, I'm going to use my cheat sheet here because I haven't memorized all the numbers. But on the peninsula, of the 1,691 cases in Monterey County, 116 of those are from zip codes on the peninsula and Big Sur. So that's about 7% of the total case count. So the health department and other entities don't want to break it down further by zip code if there are fewer than 5 people in any one area. And again, they do this in order to protect people's private health information. So if it's very small numbers, they won't give that out. But what we can see is that of those 116 cases in the on the peninsula or Big Sur, 25 were in the Marina zip code, 23 were from Monterey, 47 were from Seaside, and 21 of those cases were from other zip codes. And I have another little cheat sheet here. So for people who were tested and diagnosed at community hospital, we have diagnosed people from Pebble Beach, Carmel Valley, Pacific Grove, Marina, Carmel, Monterey, Seaside. So pretty much anywhere you can name on the peninsula or in Big Sur, there have been cases. So no part has really been excluded. So I think that there was another person who was interested in knowing about people who have recovered, because when we look at that number 1,691, it seems like a very large number, but there's some question about how many of those are still active. And so the data that's on the Monterey County Health Department webpage shows that there's about 50 active cases on the peninsula or the Big Sur area. So that's people who have not yet recovered, people who are still in isolation or undergoing some type of treatment. In the county as a whole, there are about 721 active cases as of today. So that's kind of been some important information to know. Just it's active, it's out there, it's in all parts of the county. Now, there was the other part about, how much of the increase in cases is due to more testing? So the way we get at that is by looking at what is the percentage of all the tests sent that were positive. And of course, early on, when we didn't have really good testing resources and didn't have a lot of tests available, we were only testing a very small portion of people who had symptoms. Now, as many of you know, and have probably had a test yourself, people with no symptoms whatsoever are getting tested. People who are coming to the hospital for a surgery or a procedure, they're all getting tested in advance of those procedures. So we've had a huge increase. But what we've seen in this last 2 weeks or so, since about mid-June, we had anywhere between 0 to 3% of people with symptoms being positive. Now that's between 8 and 14% of people with symptoms are positive. So that's a big increase. And if we lump in everybody who's getting a test for any reason, even if they're not having symptoms, previously we were at less than 1% of our tests being positive. Now, in the last 2 weeks, about 3 to 4% of all the tests that are being sent from community hospital are positive. So it's a very stark change. Let's see if I answered all of that. So the question about the zip code, so you can see if they're larger zip codes. And on the peninsula, I should mention that it appears that Seaside is the zip code with the largest percentage of cases on the peninsula.
Okay, thank you.
It's a lot of numbers.
That is
Lots of numbers.
Yes. Thank you. So we have a few questions about symptoms. Sherilyn asked, does COVID-19 always present as a respiratory or taste issue?
Right, great question. Because I know that loss of taste and smell was of interest to a lot of people. So the CDC has continued to add symptoms that would be consistent with COVID-19, which is the disease from the coronavirus. So still, the vast majority of patients who have coronavirus disease or COVID-19 have fevers, chills, cough, and shortness of breath. It is pretty universal. So in addition to that, many patients have other symptoms, including headaches, sore throat, sore muscles, feeling very fatigued. So those are also very common. We also see some who have GI symptoms with it. So some nausea, vomiting, or diarrhea can also be present. And again, I want to emphasize is that it's pretty uncommon for people to have symptoms that don't have any respiratory component. It's usually respiratory symptoms with a fever and these other things. So that includes the loss of taste and smell. And also we're learning more about different changes to the skin. So a few weeks ago, the COVID toes was a big topic. So later in the course of the viral infection, people can have abnormalities or problems with blood clotting, for example, or other changes in their immune system, which can give them splotches and blotches and things like that on fingers and toes. Again, it's not common that it happens in the absence of any other symptom that would be suggestive of COVID-19. So again, I didn't bring my little cheat sheet here, but of all the people that have been diagnosed at community hospital, almost 90% of them had subjective fevers and chills. And the vast majority of them, over 75% of them, had cough and shortness of breath. So those other symptoms occurred much less frequently, probably 30 to 40% of the time.
Kristen asked, can we get COVID-19 more than once, or do we develop an immunity?
Yeah, I wish I had a really good answer to this one, because this is sort of our whole planet's first experience with this virus. We really don't have a great understanding of how the body fights it off and whether or not that immune response that you develop is going to be durable and long-lasting such that you wouldn't get it again. We've all heard the stories of people that seem to have had it and recovered and then seem to have gotten worse again. And there was often the suggestion that maybe they were getting a second round of it or they were getting infected for a second time. We really just need to get more information from close research studies to figure out what the answer to that is. So obviously learning a lot more about the immunity to this virus will help us in creating a vaccine, which again, all of those studies are really ongoing at a very rapid rate, unlike any other thing we've ever seen. I mean, this is really a global enterprise to figure out the answers to these questions. So right now, we can't say for sure, if you get it once, you'll never get it again. You know, I think we can look at what we know about from other viruses. So for example, it could be like influenza. It could be like flu where you have had it, but unfortunately you have an immune response that's not really effective to prevent you from getting it again. So it may end up, we find out it's like that. Or it could be like some other common viruses that used to be very prominent, like measles, such that once you've had it, it was felt that you developed a lifelong immunity to it. So we'll just have to let time and some more research studies give us a clearer answer about that.
Marie asked, what is the criteria with temperature checks for someone to stay home? The CDC states 100.4, but my thought is any elevation in temperature could be suspect.
Right. So a lot of people do question about what would be the number? What's the exact number where you should start to be suspicious that this is a fever or a symptom that could suggest that you have coronavirus infection? And there are a lot of different numbers. For a while, the CDC had 100.0, others will say 100.6. So the answer is, what's the real answer? And the real answer is, right now, we would consider anyone who subjectively has the feeling that they're feverish or subjectively just feels chills. That would be reason enough to say that that's possibly a symptom associated with coronavirus infection. But so in essence, the actual number is a little less important, as opposed to, this is something that's a change in my body. I'm feeling feverish. This is different for me. This is not my usual. So that's kind of an important aspect for a lot of these symptoms, because as it pertains to things like cough or sore throat, a lot of people have allergies, and they can have those symptoms. So it's really understanding that this is a change for you, and that these symptoms are not something usual for you and cannot be explained by some other common condition that you normally have. The thing about temperature that we can talk a little bit about too is because I know a lot of people are very concerned about how screening is being done. So if you go, for example, to your doctor's office, or if you come to community hospital and you want to come in and get a blood test or an x-ray, we're taking temperatures at the door. I know a lot of schools are making their plans for how they may be able to welcome students back in August. And a lot of these plans involve temperature checks. So again, the temperature that you have with coronavirus infection may not be particularly high. It's probably not always going to be present, because most of the fevers will come and go. And some people, although it seems to be a very small portion of them, may never have a fever. So, I think that you're going to have to follow the specific number if you're going to work, for example, or being screened to go for a procedure or a test. Most of them will be fairly consistent of sticking to the CDC's number. But I think the most important thing, too, is when they're asking you about symptoms, they will ask, have you subjectively felt feverish or chills? And that's probably a more important indicator than your temperature at any one particular time.
Susie asked, how long can a no-symptom COVID carrier transmit the virus, and do they test positive?
So at least we have enough information from this pandemic going on for as long as it has, that it does appear that there is perhaps a 2-day period during which people are infected and contagious, but generally don't have symptoms. So usually that's what we call the pre-symptomatic phase of the infection. So people can be 2 days, probably no more than 3 days, where they're infected and potentially shedding the virus to those around them. And during that time, those people would test positive. So they would be asymptomatic, but positive for the virus, and they'd be contagious. Now, there's a very, very small group of people that may be contagious, but never have symptoms. So those people could go through the course of the disease 10 to 14 days where they would be contagious and test positive, yet be without symptoms. Now, this gets to a key point, Susie's question, and that's sort of why we're all wearing these face coverings, is because, you could be contagious, have absolutely no symptoms, and then 2 days later start developing the fevers, the chills, the coughing, the shortness of breath. And that would have been 2 days before that you could have been exposing friends, family, close contacts, coworkers, people you see in the grocery store. So it's a long enough window that we need to be aware.
And Susie sent a clarification question, just saying, would you test again in 14 days if you tested negative the first time and you were exposed?
Right, so it's about when to test then. So the answer is it depends. It depends on why you're seeking the test. So if you need it to document for work or for travel that you're negative, then yes, most of the authorities that are mandating testing for those purposes would say that you would need to have a subsequent test 14 days later that's also negative. But again, I caution people who are getting tested without symptoms that you could really get yourself into this place where you're just worried and would want to seek the reassurance of negative tests. But you could be tested every 2 or 3 days, and it's only one small snapshot, one point in time. So I would really caution against repeated testing if you're not having symptoms.
Jay asked, any understanding of what features, either host or viral, can help explain the extreme variation in clinical syndromes with this virus?
That's a great question, and another one that we don't really have a really good answer to. There are a couple things that we do know about what leads to some of the variation. Why, even members of the same household, some of them could be just very mildly ill, and others would be ill enough that they would need hospitalization and really intense supportive care. So there are some underlying chronic medical conditions that would put people at risk for more severe disease. And particularly we're seeing people who are poorly controlled diabetics, people with high blood pressure, and people with obesity. That subset, especially if you have those in combination, seem to put people at higher risk for severe symptoms. We also see that people who have underlying lung conditions or breathing problems at baseline, or who could have compromised immune systems because they're undergoing cancer chemotherapy treatments or they're on other treatments that suppress their immune system, these people are more likely to have a more severe course. Now, what is it about the virus that may make people sicker, some sicker than others? There are certainly some interesting ideas, such as maybe how much of the virus you were exposed to. For example, did you breathe in a whole lot of the virus deep into your lungs and so got a really large dose that infected you? So there's a lot of research going on to see if that may be in part responsible for people who get very severe disease. But certainly when we look at the people and the risk factors related to the people, it's these chronic medical conditions. Like I said, I'll repeat them: diabetes, especially if it's poorly controlled, high blood pressure, with or without being on high blood pressure medications. You can have perfectly controlled high blood pressure. Just the fact that you have high blood pressure is a risk, and then being obese. Those seem to be the biggest ones.
This question comes from Sachi. It is being reported that a vaccine for COVID-19 may become available at the end of this year. Given past challenges with developing a safe coronavirus vaccine and the time needed for safe testing and clinical trials, how realistic is it to expect a safe, effective vaccine in the next 6 months?
Well, I hate to be a real downer, but for those of you who are holding out hope that, in 2020 we would be, gearing up to do mass vaccination with a safe and effective vaccine, I think you're going to be disappointed. Right now, there are some candidate vaccines that are going into very large-scale clinical trials, so that's certainly very encouraging. And but those clinical trials, again, take time to enroll, time to gather data, time to analyze the data, and there's no guarantee that the ones that are starting into clinical trials now will actually be proven safe and effective. We certainly hope they will be, but I don't think that it's going to get us to something where we're talking about getting ready to vaccinate everybody within the next 6 months or even within 2020. Because again, remember, when we have safe and effective vaccines, we're going to have to produce enough of that vaccine to vaccinate everyone. I mean, not just everyone in the United States, but everyone. So what's probably going to happen is there's probably going to be more than one vaccine, and hopefully we can get several of these vaccines made in large enough quantities so that we can really start rolling out mass vaccination. I would certainly hope within a year that we'll have a much better idea of what the timeline for that's going to be.
So going a little bit into the prevention realm, Corey asked, there seems to be a lot of controversy both in layman and scientific circles about the CDC recommendation of wearing masks. Can you explain the relevant research that has come out regarding the effectiveness of cloth masks to prevent the spread of COVID-19?
This is great. I'm really glad this question came up because it is probably one of the most often talked about and questioned recommendations that's out there. So the use of the masks is, and the benefit of them is sort of twofold. So like I said earlier, people can be in this 2 to 3 day window where they're infected, they're contagious, and they don't have the slightest inkling that they are going to get sick. And so during that time, even though they may not be coughing, any of the particles coming out of their mouth, so anything with saliva or spit or anything out of your nose, and we've talked about this, like people touch their face all the time. So if someone is there, they're talking loudly, they're laughing, they're shouting. So even if they're not coughing particularly violently, even a sneeze, they can shed these viral particles, these droplets, without even knowing it. But if you were to put the cloth mask on your face, this would effectively block most all of those contagious particles from coming out of your nose and mouth. So that's a way that you can protect your family, your friends, your loved ones, everyone with whom you come into close contact from inadvertently, unwittingly by you being infected. So I think that a lot of people do this because they really care about all those who are around them, and they would hate the thought that they could possibly have infected somebody who was near and dear to them. Now, the other benefit of it is, like I said, we touch our faces all the time. So when you have this on your face, it's much harder for you to rub your nose or touch your mouth. So it's kind of a constant reminder while you have it on that you should keep your hands clean and not touch your face with hands that haven't been cleaned. So I'm sure all of you are watching. You probably can count up for me how many times I've touched my face or how many times I will touch my face. But it's sort of that reminder that not only am I preventing all of this from potentially infecting people around me, it also prevents me from touching my face and potentially infecting myself if I have touched a hard surface or something and I could have picked up contagious virus and then infected myself by rubbing my nose, scratching my eye, or whatever else.
So we had several people send in questions about cleaning and disinfecting items such as groceries and frequently touched surfaces. What should people be concerned about, and what cleaners should they use?
Great. So there's probably one of the good things about this virus is that it is very susceptible to what we call low-level disinfection, which means it's not very hard. You don't need to use bleach. You don't need to use industrial cleaners. You can use all of the common household products for cleaning and disinfecting. You don't need to do anything special. So all of what you probably are already using to clean your kitchens and bathrooms would be perfectly appropriate to disinfect and sanitize your frequently touched surfaces that would kill coronavirus. So what we mean by frequently touched surfaces, we also mean hard surfaces, because those are the surfaces on which all of those contagious particles are going to land. And then they can survive on a hard surface for a prolonged period of time. And because it's a hard surface, it's very easy for then people to touch that hard surface and have those droplets and the virus in them transferred to their hands. So that's why it's particularly important for surfaces like this table, like the tile in your kitchen and bathroom, to be wiped down. Now, other surfaces are less of an issue. So anything that's paper or porous, meaning it can absorb liquid, that includes cardboard, boxes that things have been packed in and delivered, or mailing envelopes, like those things, which are a little bit more absorbent and wouldn't be like a hard, shiny surface, they don't seem to harbor those droplets quite so long as it would be on a hard surface. So when people are worried about bringing groceries home, it's really not necessary for you to disinfect or wipe down all of the groceries coming into your home. It's much more important to focus on your hands. So always clean your hands. When you've unloaded all the groceries, clean your hands. So that's, I think, probably the biggest thing. Again, taking everybody back months and months ago, there was a lot of concern that people were getting packages in the mail from China, and they were worried that the virus was going to be transmitted by touching these packages and envelopes. But there's no evidence to say that the virus is going to be transmitted from touching anything that comes in a mail or anything like that. So just keep your hands clean and away from your face.
Lilani asked, I'm a little confused by the recommendations regarding contact with people not in our immediate household. If I visit with a friend outside and we sit at least 6 feet apart, should we still wear masks?
Well, great, and I think we're modeling behavior for you here, which says that if you can maintain an appropriate distance, particularly if you're outside, then the use of the mask would be much less important. So, when we talk about asymptomatic people possibly shedding contagious particles and things like that, especially if you're in an outdoor place or an indoor place with good ventilation, they're not necessarily going to travel that far in large amounts. So that the suggestion now is that if you can maintain a proper social distance of at least 6 feet, that you would be able to take the masks off. So this is how I know friends can get together. They can sit outside. They can take their masks off. They, can enjoy each other's company. I myself, I can share, have had gatherings with small numbers of friends where we sit outside, maybe 6 or 7 of us, all 6 feet apart, and we all bring our own glass of wine, and obviously we don't wear our masks for that. And what we're finding too is outside is a really good idea, because again, if there is, on the off chance that somebody doesn't know that they're infected yet, if you're far enough apart and you have good circulation of air, good ventilation, that should continually refresh the air and keep any of those virus particles from landing on those people with whom you're visiting. I think this also brings up a good point that our county health officer, Dr. Ed Moreno, had introduced the concept of social circles about a week and a half ago, because I know people are really craving being out and socializing with friends, or hear stories all the time of extended family members, like they haven't been able to see aunts and uncles and grandparents for a prolonged period of time. But the suggestion is if you keep those social circles small and stable, and you're not mixing and mingling with large numbers of people who are out mixing and mingling with other large groups of people, you can really minimize your risk by maintaining a small social circle. And in those instances, it may also be appropriate for people to visit with each other without wearing the masks, particularly if children are involved. So I think that might be a segue into the next thing, because I know that that's kind of a big issue for a lot of parents out there is, what to do if your children want to play with other children and are not really able to tolerate or wear a mask properly. At what point would it be okay to let them go out and not wear a mask?
Yes, so that is definitely the next question. It was probably one of our most asked questions was about schools. So people are wanting to know, is it safe to go back to school, and what should parents know about sending their kids back to school?
Yeah, this is really a question that's nearly impossible to answer, because there are so many things that go into the school reopening plans. Schools are highly regulated, so they're certainly going to be working within a framework of a lot of regulations. So what's possible for one school may not be possible for another school, just based on their own facility, their building, the area that they have. But in general, there are certain things that all of the schools are considering. And of course, number one is health and safety of the students and the faculty and everyone who works there. It's particularly a challenge when you have young students, so like elementary students, where it can be really challenging, one, to get them to do proper hand hygiene. I have 2 school-age children myself. Hi, Miles and Ellie. Are you guys watching? And you know, they just have a hard time with hand washing or even using the alcohol-based hand sanitizers. And then on top of that, you know, really young children may have a very hard time wearing the masks. So I know all the schools are working really hard to come up with plans that work best for their students, their faculty, based on all of the restraints that are put upon them, and working with whatever facilities they have. So they're all different. All the plans are going to probably look slightly different, but they're all going to include the same elements of excellent hand hygiene, like having plans in place for everybody to have an opportunity to keep their hands clean. Another aspect of all of them is going to be the screening of everyone that's coming in and out of the schools to, you know, have people say, yeah, there are no symptoms, there's no coughing, there's no sore throat, we're not having any fevers. So, you know, it may sound pretty straightforward, but that's what we've always said is, you know, if you're sick, stay home. You know, don't send sick kids to school. But now they're going to be very formal about asking people before entering to say, yes, I'm not sick, we're not having any of these symptoms. And then in addition to that, there is probably going to be a role for having students of nearly all ages wearing face coverings when they cannot be an appropriate social distance apart. So that's a real challenge, and I know all the school districts around here are working as best they can to figure out what's going to be the right balance to maintain those basic core infection prevention measures at all of their facilities. It does bring up a point of something that I had been asked, and I don't think it's on here, but it kind of came up in this context, which is, you know, it's really hard sometimes to communicate with almost all of your face covered, and especially with children. You know, that having their face covered and trying to communicate or gauge the emotional response of a child when their face is covered is really a challenge. Same thing, like if teachers are trying to project their voice and kind of teach to the students as they're spread out in the room, the idea would be do something to be able to remove the mask. So again, if they're far enough apart, the masks could be removed. But the question came up whether or not face shields, because I'm sure you've all seen this too. I've seen it, where instead of wearing a face covering that covers the nose and mouth, people are instead using clear face shields or some other sort of a shield over the face. I've seen people in the grocery store with like a welder's helmet kind of mask on. And I would let people know that is a different type of protective equipment, and it does not play the same role that a face covering does, because if you wear that without wearing the mask, you still have the potential of spreading all of those particles from the nose and the mouth and disseminating, spreading them a pretty far distance, because the face shield is really to prevent things coming at your face. So like if someone coughs or sneezes on you, and I can totally see that in an elementary school setting where kids are not good about covering their cough or their sneeze. So it's really not going to give you the same level of protection as a face covering would have. I would say if people want to use the face masks, they could use it in addition to the face covering, but not instead of. So the two together, but not one to replace the other.
So we're going into doctor visits now. Eric says, I have a chronic condition. My doctor knows me well and could help remotely, but insists on an office visit. I'm afraid to catch this virus and don't want to go out. Which of us is right?
Wow. I don't know that I'm going to be able to say which one of you is right, but certainly in this day and age, I know that all of the doctor's offices have gone to great lengths to put in place safety plans so that in-office visits can be done more safely. So I would say if you have concerns about going into a doctor's office for a visit, call the office in advance and ask the people in the office what precautions are they taking to keep you safe when you come in for an in-person visit. And I also think that for those people who have those conditions where they may be more at risk for getting severe disease, if this is something that their doctor feels could be done in another format, such as a telephone call or a video visit, I would certainly ask and see if that would be appropriate. But there are still many, many cases where those video visits and telephone visits are not really adequate to replace an in-office, in-person visit with your doctor, such as something where you would need to have a physical examination. So it may not be possible that every visit could be done remotely. But right now, and certainly at Community Hospital, we're doing our best to offer people virtual visits. We still have the free e-visits available for people who are concerned that they may be having respiratory symptoms suggestive of COVID. So those are still available at montagehealth.org or chomp.org. You can get the link to those e-visits. And I can even tell you too, for when people come to the emergency room and if they have symptoms that are suggestive of COVID, we are immediately triaging and separating the population of people with symptoms suggestive of respiratory illness from the other population of people, because we want from the very beginning to try and protect everyone who needs to come to the hospital for emergency services. The doctors in the emergency room are actually using iPads and other remote technology to do visits with the emergency room patients as needed. So all of that technology was developed very rapidly in March and April, and I believe is here to stay for certainly the near term as we continue to have to care for people and protect our healthcare workers from being, again, inadvertently exposed. But it is safe to come to the hospital. It's safe to go to your doctor's office. If you are concerned about going into a healthcare facility, I would urge you to call in advance. Whoever is scheduling you for the appointment, have a conversation with them so that they can tell you and hopefully reassure you that they're doing numerous layers of preparation so that there's not going to be undue risk to you for coming in for healthcare services.
Wonderful. Now we're moving to some of the questions we've seen come through the feed on the live Facebook. And I think you've answered part of this question. This is from Christine. I'm going to be giving birth at Chomp anytime now. Congratulations, by the way. How can I ensure that myself, my newborn, my nurses, and the doctor all stay healthy? What is being done to not expose these people? I'm nervous to even walk into the labor and delivery unit.
Right. So, yes, congratulations on your arrival. That'll come anytime now. And what a time to be having a baby. But we have been particularly focused on the health and safety of our soon-to-be moms, our postpartum moms, our new babies in the Family Birth Center at Community Hospital. We've had special plans in place there since really March. So again, I would say this might be a good time to ask your obstetrician about what's the procedure going to look like, because we do have screening procedures for all moms in labor, because we want to be sure that anyone entering the family birth center has been screened in advance for coronavirus, even if they're not having any symptoms, because we truly appreciate that moms and newborn babies are a particularly vulnerable population. So we have been routinely screening for that, and we've been using what we call enhanced personal protective equipment in the family birth center, so that the doctors interacting with the patients are taking all the precautions so that they will be safe, and then we're taking precautions with the moms and the babies afterwards so that they will be safe. So the family birth center is looking a little bit different these days in terms of restricted access, in terms of the levels of personal protective equipment being used, and also in terms of all moms in labor being screened to ensure that they have a negative coronavirus test before going to the family birth center.
So there was another part of the question that said that someone heard that a nurse can go back and forth from a positive person's room to another room next door for a patient. Is that true, and can you speak to that?
Right, so unfortunately, we have seen increased numbers of hospitalizations in the last couple of weeks at all of the area hospitals. So we now do have a number of COVID positive patients at community hospital, and all of those patients are in isolation, which means that they are in individual rooms. And in order to enter that room, any healthcare worker entering for any reason needs to be wearing all the appropriate protective equipment. So, and this is for people who've maybe been in the hospital before, they may be familiar with this, that we also do this for other potentially contagious infections. So we do this for resistant bacterial infections. Those patients that have documented resistant bacteria, or people that have other easily communicable infections, they are also placed in isolation with an appropriate amount of protective equipment for all of the healthcare workers that go into those rooms. All healthcare workers are trained in how to put that protective equipment on and how to remove it properly. And again, this is 100% so that whatever they are exposed to while they're in the room doesn't come out with them, so that they remove all of that protective equipment and they clean their hands before they go and do anything else. So in essence, it wouldn't be inappropriate for a nurse to care for someone who's in an isolation room as well as someone who's not in an isolation room, because in between those patients, they would have properly removed all of the protective equipment and properly disinfected their hands before doing anything. So part of me feels like it's not even an issue whether or not they're treating someone in isolation and someone not in isolation. It's anytime they treat anyone in isolation, they need to do all the proper things so that they don't go, for example, to the workstation and start typing on the computer with hands that they didn't clean, or go and receive a phone call and start touching the handset on the telephone without having taken all of the proper precautions in order to clean their hands before that. But to get to the bottom line here is that we right now are assigning nurses to care for those patients in isolation, often because they do have great needs in terms of nursing care. So many of these patients will have their own nurse assigned to them if they are critically ill, for example, on a ventilator, or we will have nurses assigned only to care for those patients in isolation.
So there were several of you that asked the question about antibody tests. So we'll quote Tiffany's, which says, do you know the reliability of the antibody test? And I'm going to put this into layman's terms a little bit, but I know there are different types of antibody tests. So can you talk to, is there a difference between the reliability between one antibody test to the other?
Right, so the antibody tests are not uniform. They're, especially in the early days, the FDA had listed, I think, almost 120 different antibody tests that were out there. And to be clear, we don't have any FDA-approved antibody tests. There are some that have been authorized for emergency use. And again, that does not mean that the FDA has done their thorough vetting and investigation and declared that to be a suitable test. It means that they had approved it for emergency use, understanding that this is a pandemic and that there's not necessarily time to do all the usual validation that they would for a test. So that being said, in early days, there were, like I said, over 100 of these out there, which hadn't been vetted. Now the FDA has gotten a little stricter and has actually taken many of those tests off the list to say, we haven't done any evaluation of them. We really cannot give them any kind of recommendation whatsoever. So the ones that are out there are several that are available from large commercial labs that people might have heard of, like Quest Diagnostics. We have an antibody test available at community hospital as well. Most of these are looking for the antibody that would be detectable in the blood after someone has recovered. So these antibody tests are not being used to diagnose people with COVID-19 or the disease caused by the coronavirus. So an antibody test would not be appropriate for that. These tests are to look and see if there's evidence that your body had been exposed and now that you've recovered from it. So right now they're probably appropriate for people who are curious to know, hey, I was sick, back in February or March, and I'm wondering, was that coronavirus? Some of these tests, may be helpful and satisfying your curiosity. The other thing that they're going to be helpful for is for research studies, where they can do broad surveillance of a large part of the population and just see how many people out there have this antibody indicating that they had been exposed and recovered from the coronavirus. I don't have any research data, but I can tell you that from the tests that have been run at community hospital, we're seeing 1% to 2% of those tests being positive for antibody, indicating that people had been exposed to it. And that's pretty much on par with what we had been seeing in terms of how many of the tests for the virus were positive. And again, these are not scientific studies, so they were not done in a non-biased way. Like I said, most of the people getting the antibody tests are having them done because these are people who are really curious to know. So it's not an unbiased segment of the population. And again, the reliability is to be determined. So those being done at hospital laboratories or commercial laboratories are probably a bit more reliable than ones that are done with just a finger prick or one of those 5-minute tests. So those, we don't have any data about how reliable they are, but the ones for the larger labs are perhaps a little bit more reliable.
And just as a question of clarification, the antibody tests that are done at community hospital are for inpatients, or when would we do one? Because someone can't just walk up to our...
You need to have a doctor's order for it. Yeah, so yeah, they're not, first come, first serve. It's the lab can do that if ordered by a doctor. So you would have to ask your physician, is it appropriate for you to have this test? Your doctor would talk to you about, well, why do you want the test? What do you expect to know about the test? So I do recommend, if people are interested in doing that they talk to their healthcare provider to see if it's appropriate for them.
Is CHOMP utilizing any antivirals against the virus? If so, how effective has it been?
Great. So treatment, yeah. Again, I wish this is something that I could be a little more optimistic about. But as it stands today, we don't have any, clinically proven effective treatments for COVID-19. People have probably heard a lot about Gilead's antiviral medication, remdesivir. So that was shown in a couple of clinical trials in China and the United States to indicate that there was a benefit. Now, exactly how much of a benefit and who would benefit most from getting this antiviral treatment is something that's still ongoing in a number of clinical trials. But once we saw preliminary data that said that this antiviral appeared to be beneficial and not harmful, what happened on May 1st is that the FDA made that antiviral available, again, as emergency use. So it is not FDA approved. It is something that the FDA understood that this is a pandemic, this is an emergency. We have something that shows that it doesn't seem to hurt people and it may help some people. So on May 1st, they made it available for emergency use, and Gilead donated their entire existing supply to the US federal government to be distributed according to local need. So essentially, they distributed this donated supply of the antiviral to communities based on how many cases they had there at the time. So we got that through the county health department. So Monterey County did get an allocation of this antiviral medication and has been used to treat a number of patients in Monterey County. It's including patients at community hospital. We are not giving it as part of a clinical trial, although numerous clinical trials, like I said, are still ongoing. It was given as part of this emergency use authorization. So we can't really say, since we didn't do a very closely controlled clinical trial, to say, did these people do better than people who didn't get it? But certainly it seemed to be the impression that perhaps it was beneficial and it didn't appear to be harmful for anyone. But unfortunately, that entire existing supply that was donated by Gilead is dwindling. So we're getting to a point where it's just not going to be available. So again, we're in this zone right now where anything that's being suggested is kind of being jumped on as something that could be helpful. So certainly the use of low-dose steroids, and steroids are medications that suppress the immune system. And you may think, well, that seems wrong. Like, why would you want to suppress the immune system if you want the immune system to fight the virus? But for this disease, it looks like maybe for those who are getting sicker and sicker, it's actually an over activation of the immune system, or too much of an immune response that can make people super sick. So certainly the use of these steroids, again, the thought being they could be beneficial and they don't appear to be particularly harmful. They're being used. Another really old-fashioned treatment is out there, and that's using blood plasma from people who have recovered. This goes back decades, if not a century, the idea that you can use the antibodies that have developed in somebody who had the disease and fought it off and has perhaps protective antibodies. You can take their blood plasma and transfuse it into somebody to passively offer them immunity. So that's certainly a very old school approach that's been given to tens of thousands of people across the country, and it's been given to people here in Monterey County as well. But again, this is something where right now, your best defense against this virus is to not get it in the first place. Because if you get it and you get severe disease, and we run out of these treatments, or we find that they're not particularly beneficial, what we have is we have supportive care. We can give people oxygen, we can give them medicines to support their blood pressure, we can give them IV fluids, but without any truly proven effective therapies for treatment, we're kind of in a place that's a little scary to say, we just have to wait for them to develop new drugs and get those treatments out there. So really prevention is why we're all sitting around talking, is that your best defense is just don't get it in the first place by doing all of those social distancing, covering your face, cleaning your hands, cleaning surfaces. We can't say it enough. It's just so important.
Thank you so much, Dr. Blum. I know we're out of time. Is there anything else that you wanted to add that you would like everybody to know before we sign off?
Yeah, I do want to tell people, I feel like, we're getting at another critical juncture. We were asked to do some extraordinary things by staying home for a very long period of time. And then beginning May 30th, we were sort of given a little bit of permission to go out and do some more things. And I want people to know that when you are out in public, it's important to follow all of those recommendations to protect yourself. It's, as long as we have the suggestion that it's okay to go to stores, to the grocery store, as long as you're doing all those things to protect yourself, but really minimize exposure to large crowds, minimize mixing and mingling with large crowds. It's all you can do to protect yourself, your family, and those who you care about.
Wonderful. Thank you so much. And for those of you who we didn't get to your questions, we apologize. A lot of those answers are on chomp.org/coronavirus and on the Monterey County Health Department website. So definitely recommend that you go to those sites and look up that information. And we have recorded this, and we plan to have a copy of this video on our webpage in a few days in case there's loved ones who you would like to share this with. And thank you for joining us today. We appreciate it.
And clean your hands.